Brunch, A Taste of Tobago. I just want to thank you guys so much for tuning in today, for staying with us. And it's so refreshing to have the opportunity to speak on various aspects of our lives. And one such aspect is suicide prevention. It's something that we keep sweeping under the rug, but you know what? It definitely needs to be highlighted and it definitely needs to be discussed and delved into as much as possible. Now, my next guest speaks very, very candidly to that. Dr. Williams is here with me on the brunch set, and she is a clinical psychologist. Did I say it correctly? Wonderful. And she is going to be speaking to us about suicide prevention. You know, I'm just going to let you do your thing. I would interject at,
Okay.
at certain points,
Right.
but let's touch on, what my thing is the rates of suicide. This is what plagues me. Let's touch on that. Let's start there.
So let me just mention that on the 10th of September every year, we
Mhm.
celebrate World Suicide Prevention Day, which began in 2003. And the main aim of that day is to highlight that suicide is preventable.
Right.
We are trying to raise awareness, bring to the fore discussions about suicide and suicide prevention, and get stakeholders involved because suicide is a major public health concern that has far-reaching consequences emotionally, socially, economically. So what are the rates? Globally, about 800,000 people die by suicide every year. In fact, it's estimated that every 40 seconds, someone dies by suicide. And for everyone that dies by suicide, there are many more that make attempts on their life. We know that suicide is among the leading cause of death in the United States and around the world. But interestingly, in persons between the ages of 15 to 29, it's the fourth leading cause of death. In Trinidad and Tobago, we are currently ranked third in the Caribbean, behind Guyana and Suriname. And globally, we are ranked 75 out of 180 countries. And our rates are rising. In 2019, we had 92 reported suicide. In 2020, we had 104. In 2021, we had 128. So the numbers are rising, especially among our young people, and it's becoming a major concern for us.
One of the questions, whenever I see initiatives such as these, one question that I have to ask is, what is the theme? What does this initiative embody?
Right.
Yeah,
So
let's touch there.
the triennial theme, the theme for the past 3 years has been hope through action. And a major aspect of suicide and people that have suicidal thoughts is the loss of hope, so a state of hopelessness.
Right.
And we believe that suicide prevention involves more than just talking about it. We have to act. And so hope through action allows entities, not just the individual that may be experiencing suicidal thoughts or have plans, but their families, institutions, organizations, to come together to be proactive about suicide prevention. And suicide prevention is a major marker of progress. According to the UN, a low suicide rate is exceptional in terms of mental health for our country.
Definitely. What are some of the risk factors for suicide?
So there's so many risk factors. Risk factors could be from an individual level, from a psychological level, social level, biological. But in general, the major ones we want to consider. Has the person had a previous suicide attempt? That's a major risk factor because history sort of predicts future attempts, right? Does the person have a mental illness? Are they diagnosed or experiencing depression?
Right.
Risk factors would also be loss, and this loss could be financial loss, loss of a relationship, loss of significant assets, grief, right? That represents another loss. the experience of trauma or a childhood history of negative events such as abuse and neglect. Risk factors also mean chronic pain, having to deal with chronic medical illnesses.
Yes.
So in most cases, it's pain, but it could also be people that have been diagnosed with a serious chronic medical condition. And there are other risk factors like lack of social support, the inability to sustain oneself, either because of poverty or something else, lack of access to resources, and substance use. That's another big risk factor, especially in Trinidad and Tobago.
You know, who is more, I want to make sure that I word it correctly. In your expertise, your research, your analysis, who is more susceptible to
dying by suicide?
Yes, suicidal death, men or women?
So we know that women make more attempts, more suicidal attempts than men, right?
Yeah.
In a higher proportion too, right? The ratio could be 5-1. But men are more likely to die by suicide. And the reason for that is because women, in general, women tend to use less lethal means of dying. So for example, most women tend to overdose. And that means they have the opportunity to be rescued or recover.
Right.
Whereas men tend to use very severe lethal means, especially violent means like hanging, the use of guns, the use of pesticides, for example, where it's likely that death will occur. Women also tend to seek help once they've attempted suicide. They tend to reach out to someone before or after the act, whereas men don't usually do that. So we find that men would die by suicide more, but the attempts come from women more.
How are elderly persons affected? Do we see a rise in suicidal attempts by the elderly?
Definitely. The elderly is an ignored population when it comes to suicide. They're not talked about much. They're not the experience of suicide among the elderly isn't explored as well, but they are actually at risk. In fact, the numbers in the United States, for example, are so high that they constantly have to be monitored. So elderly folks especially deal with chronic illness. But one thing that makes them more at risk is social isolation, the lack of community support around the elderly person. That connectedness, exactly. So elderly people are more likely to make plans to take their own life that are likely to result in death. They're very meticulous about their planning. It's usually not from a place of impulsivity compared to younger people.
Right.
Many times young people that take their life or attempt suicide have done so under the influence of substances or by being emotionally impulsive. But in the elderly, it's more deliberate, more planned. They're also likely to not be found in time because they either live alone or they don't have access to, like for example, if a young person isn't posting online all the time or they're not checking up on friends, they're more likely to be like, where's this person? Let me check in on them. But with the elderly, it's not that way. Days could pass, right? So they're not likely to be recovered in time. And also, because of their physical frailty, it's likely that even if they were rescued, they would succumb to whatever injuries because they're already susceptible due to their age.
Right.
So we know that disability, pain, social isolation are things that put them at risk and sort of feeling like a burden. That's another thing that relates to suicide a lot, that feeling like I'm placing a burden on my family or my loved ones to take care of me.
What would you say are some warning signs?
So when it comes to warning signs, this is a tricky area. And I actually did a post about this yesterday on Facebook and Instagram, because if we go on Google, we would look for the typical warning signs that they will tell us to pay attention to. So a change in the person's personality, behavior, or anything that just seems out of character for that person. They may be more impulsive, irritable, angry. They may be engaging in more risky behaviors, but also you might notice withdrawal. So they're pulling away from people. They're not interacting as much at home or at work.
Right.
You might hear that they're talking about death or even making jokes about death. They may go and research ways to die, Or you might find that they're giving away possessions, letting go of things that meant something to them, or trying to make contact with people that they haven't spoken to in quite some time as a way of saying goodbye. There might be increased substance use. There might be a lot of risky behavior or risk-taking involved. But simultaneously, and this is what I want to highlight, suicide doesn't always have a look. There is a campaign in the UK called The Last Photo. And I encourage everyone to go on the website, The Last Photo, and look at the pictures that family members would have taken of their loved one, or even, so it's great, it's on the screen.
It's on screen.
Right, beautiful. So these are actually pictures that people have taken of themselves or of their loved ones hours to days before taking their life. They look happy, they're smiling.
Yes.
You would not tell overtly that something is wrong. And so this campaign highlights that a lot of times people suffer silently. There is still a lot of stigma surrounding suicide and suicidal thoughts and depression and mental illness. And so people may not always feel comfortable sharing. And so we can't just look for somebody that's suicidal. What we have to do is, when you notice changes in any way, or when you know someone has experienced anything that can predispose them to suicidal thinking or an attempt, you want to ask directly. And I know it's uncomfortable for people to do that. And people have been taught, no, if you ask them, you'll put the thought in their head. If someone wants to die by suicide, the thought is already there. You can't put that thought in their head.
Exactly.
So asking directly is important. And the reason for that is because consistently, research has shown that many people, no matter how secure or sure they are that they want to die, there's always a place of ambivalence. There's always that space between wanting to die and wanting to live. And your question can help to bring them out of that.
Definitely.
So ask directly. You recently lost your loved one. Have you considered taking your own life? Have you thought about that? Just ask directly.
Yeah, I was just about to ask, and you touched on it so well, how we can prevent even the thought that triggers the mechanism. And you just touched on direct speech.
Yes.
Remember, we're not sugarcoating, we're not beating around the bush.
Correct.
Because that conversation can usher in probably a different outcome.
Definitely.
Because, as you said, the ambivalence is there.
Yes.
And sometimes they're even like 50-50, wanting to live,
wanting to die. There's always ambivalence. And we have information about this from people that have survived serious suicide attempts. There's one person in particular, he had jumped from the Golden Gate Bridge in San Francisco. And he said the moment his hand left the bridge, he knew that he made a mistake.
Yeah.
And so our goal is to get to that place of ambivalence and pull them out of it. Again, creating hope through action.
Yeah. And what should I do if I come into contact with someone and they are adamant about, listen, I can't take this anymore, I want to take my life.
Yeah.
What can I do as the person in the situation with someone who wants to take their life?
Right. So it's very uncomfortable for people who are not trained in this area to be faced with a situation like that. And it's very difficult to understand a person that has suicidal thinking, because if you are not depressed, if you are not in the same position as they are, you have the ability to see things from a very different perspective. Someone that is having suicidal thoughts has a very narrow or constricted viewpoint. They could only see the negative, the problem, the issue before them. So what you want to do in that moment is listen to what they have to say, listen non-judgmentally. It's not the time to talk about all the good things that they have in their life, what we call toxic optimism. This is not the time to say, oh, but look how much good things you have, look how much things you have going for you. So many people have it worse than you. It's not the time for judgment. It's not the time to talk about hell and heaven and, their relationship with God. It's just about you listening. That's the first thing. The second thing is you want to discuss the way forward in terms of offering them a way that they could seek professional help. And if not professional help, it's important that you disclose to someone else what this person has told you. And that it's very difficult for people because sometimes people would say, I'm thinking of taking my own life, but please don't tell anyone. Please don't tell mommy. Please don't tell auntie. Please don't tell my husband. I want to implore everyone to understand that this is not the time to keep confidentiality. When someone explains to you that they have plans to take their life or that they're having serious thoughts about taking their life, you have to inform someone else, inform the next of kin, inform the people that they live with, and try to get them professional help, because preservation of life is more important at that point than maintaining the friendship or the relationship, right?
Or keeping in confidence.
Exactly. Keeping
Yes.
it's not the time to keep things confidential. You want to get the person help as soon as possible. So you do want to say that you are here to listen and listen non-judgmentally, but also to help the person be pointed into areas where they could have access to the help that they need. So providing resources, etc. And then in terms of managing it after that, the family has their role, for example, removing things in the household that can be used as a weapon, so to speak, for taking their life. So get rid of pesticides, get rid of knives and stuff like that, get rid of medications that they could use to overdose. But we also have to take suicide prevention from even before that. In the schools, school children need to learn how to manage emotions, how to regulate emotions, cope with stress, handle disappointment, be resilient. We've had so many cases recently with young people attempting to take their life. In Tobago, in Trinidad. In Trinidad, even up to last month, there were 2 suicides reported among teenage girls.
Oh, wow.
I think one was 15 and the other one was 16 years old. And these are just the ones that were reported. There are many more that go unreported, that don't make it to the news. But we all have a responsibility. It's not just the Ministry of Health or the Division of Health. This is every division, every community, every organization, whether it's religious or non-religious, making an attempt to reach out to people and provide that level of support. Social support is the #1 protective factor against suicide attempts. And that's interesting because we live in a society now where we trained to be sort of independent and every man for themselves. But we need other people to get through difficult times, to get through changes, to help us adapt to different things. The pandemic was one that was so difficult for people to get through. And we saw the spike in suicidal attempts there. So it's very important that it's not just, oh, well, I'm good and this person is suicidal and they just have to deal with it. We all have a responsibility when it comes to preventing suicide.
And you said it so well. We all have a responsibility, each and every one of us. Remember, guys, it's World Suicide Prevention Day. I had the privilege of speaking with Dr. Alina Williams. Thank you so much for joining us.
Thank you so much.
A Taste of Tobago. We will definitely keep in touch as the journey moves forward with regards to the discussion.
Yes.
And hopefully the prevention of suicides altogether. That's where we're heading.
That's where we're heading. Yes.
Positive, positive, positive. We're going to take a break and we're going to be right back with more Brunch, A Taste of Tobago. But guys, our trivia question, I want to speak on it again before I go to the break. What was Tobago's airport first called before it was renamed? All right, so I'm waiting for those answers. We're going to be right back with more Brunch, A Taste of Tobago. See you guys soon.